Tear the aluminum foil package of the reagent card, take out the detection card, and place it on the operating table. Choose a finger to collect blood from and disinfect it with disposable cotton balls soaked in medical alcohol. Prick the finger with the needle. Draw blood through a pipette and add it to the test holes of the reagent cards. It is recommended to wipe off the first drop of blood with a cotton ball to avoid coagulation. Add 2 drops of sample diluent to the test holes of the reagent card respectively. Wait 15 minutes for the results to appear. Results of demonstration: negative results, positive results.